So we have a regime in Canada where there's actually laws that allow for recreational use as well as for medicinal use. And the medicinal side, patients have to register, and the cannabis use has to be authorized by a physician. Whereas on the recreational side, basically anybody can go and buy cannabis at an approved licensed location. So you have two regimes, which I believe creates some issues when it comes to use on the for medical purposes, because patients basically have open access to cannabis. What we're seeing is that there's this expectation on the patient side that cannabis is going to be this wonderful treatment for their pain, and on the science side, there isn't the evidence to truly support that. And so I feel very strongly that there's a need for well-conducted trials to truly evaluate the benefit of cannabis in this setting. But it's almost like the horses are out of the barn. Patients want it, and we have to find ways to better educate patients, engage them, as well as do the research to actually show whether it's going to be helpful or not. As healthcare professionals, we are, because the scientific evidence isn't there isn't the knowledge to use cannabis for medical purposes, pain management, for example, in this setting. And so we have a large information gap from the perspective of cannabis and its use in this setting, which product to use, how much THC, how much CBD, the dose, which way it should be administered. So there's a lot of questions that as healthcare professionals we have. And yet again, I go back to my comment earlier that patients still want to use it. So we have to find a way to better engage patients. So the consultation service at our center was really the result of clinicians telling us they were having patients ask them about the use of cannabis for medical purposes in the oncology setting and not knowing what to tell them. We had developed some expertise within the pharmacy department. I basically went to them and said, we can do this. We refer patients to us, we screen patients, we try to better understand what the patient expectations are in terms of the use of medical cannabis or cannabis for medical purposes. We assess them in terms of their symptoms, and then we feel if there's a need for cannabis or that cannabis may be an option once traditional ways of managing, let's say, pain have been exhausted. Then we lead the patient and the clinician through the process of registering with the government-approved grower, choosing the product, and then dosing the product, helping the patient go through the dosing of the medication to see if it's going to benefit them. We also follow the patient to assess whether it's working or whether it's having any side effects. And so in a nutshell, that's the program. We're trying to ensure the safe use of cannabis for medical purposes in our patients. We can stay with the cannabis side. I actually believe there is a role for cannabis in the management of adverse effects of chemotherapy and or the symptoms that cancer can cause itself. There's a tremendous amount of research that needs to be done, and that's the exciting part in terms of understanding the underlying mechanisms in terms of side effects and how cannabis can be used to address or to target these underlying mechanisms. So we have a research program that we have started looking at very specific adverse effects of chemotherapy that may be immune related, and how cannabis can actually modulate the immune system to reduce the side effects. For example, taxane acute pain syndrome is an area that we're very interested in. We think that potentially fatigue could be managed by cannabis. Certainly anxiety seems to be a really important issue with our patients, and we've had some success in managing anxiety with cannabis in that setting through our consultation service. Sleep disorders also seem to be, at least from our experience in the consultation service, seem to be amenable to use of cannabis as well. So I think there's a potential for a broad range of uses once we have the research to prove it.